Okay. Hello, everyone. Can you hear me?
I can hear you.
All right, awesome. Greetings, everyone. We are delighted to extend a warm welcome to every one of you to our, I think, fourth webinar hosted by the AFRONE in the mentorship program. We're glad to have you all on board and looking forward to making this a fruitful session as usual. Before we begin today's session, here are a few guidelines to help make the most of your meeting. As usual, the microphones and cameras will be turned off to minimize distractions and ensure optimal quality. We kindly request all attendees to keep the microphones and cameras off throughout the session. As for the interaction part, your active participation throughout the chat function is highly encouraged. Please add questions there. We will monitor and respond to as many as we can after the presentation. The session will run for 1 hour. First 45 minutes will have the main session with our speaker and followed by 15 minutes for our Q&A session. And please note that the session will be recorded for future reference and knowledge sharing purposes. It will be later made available, as usual, through our LinkedIn page, our WhatsApp group, and soon on an AFRONE website as well. Last thing, know that please, your feedback is valuable to us. We will share a feedback form for the webinar in the chat. Please take a moment to share your thoughts with us and fill in the form. Thanks a lot. Now, please join me in welcoming today's speaker, Dr. Taiwo. He's a dentist and principal research fellow with the Department of Basic Sciences and Research of the Inter-Country Center for Oral Health in Africa, Nigeria. He is also a facilitator for research methodology topics. He had an MPH from the University of Lagos, a master's clinical research from the University of Liverpool, and a PhD in public health from Walden University, USA. His research interests include the epidemiology of oral diseases, oral manifestations of HIV/AIDS, dental trauma, dental caries, oral health awareness, and research ethics. He's a trainee of the Fogarty African Bioethics Program in Johns Hopkins University, USA, and a member of many professional bodies. Please welcome him aboard. Go ahead, Dr. Teo.
Thank you so much for, can you hear me?
Yes, doctor, I can.
Yeah. Let's see if I can minimize this. I also want to know if you can see my screen.
Yes, but it's not on the slideshow.
I've just put it on the slideshow now.
Perfect, yes.
Awesome. My apologies. I was hoping to show my face, but as I speak to you, there's a rainstorm just where I am, and it has disrupted the lights, but nonetheless, I have my system with me, and I think that should suffice for us as we continue with the presentation. So I appreciate you all for being on ground, and I appreciate the opportunity given me to share some thoughts with you in designing quantitative oral health research. So I will just go on with the presentation, and like it was said earlier on, you can jot down your questions towards the end of the presentation to attend to. I would like to start by defining research. This is a definition I love so much, that research is a systematic investigation designed, that's the key word that we'll be talking about, designed to discover and contribute to a body of knowledge. It's not just something that is done haphazard. There's a format that it follows, and it is when that format is followed that we can say the study is well designed and then it is reliable. Before we go further, I want to quickly define some terminologies that we might be coming across that can cause us some kind of confusion. I'll be defining what we have as research methods, research methodology, research designs, and then research approach. A research approach is the strategy or framework that we use to implement that research. It's just like an umbrella approach to a particular research. The design is the plan that we have to answer that particular research question that we want to study on, while the method is actually the procedure you as a researcher use to collect, to analyze, and to interpret your data. The research methodology is a systematic way, that is the whole process, of doing research. And I have a slide just on the next page, that talks about what research methodology entails. It is the whole research process, starting from research question and ending with report writing or manuscript writing. So this is the research process. It starts with identifying objectives, your hypothesis. We talk about the design you are going to be using for your study, which is where our emphasis is this evening. We'll talk about the sample size, sampling method, data collection, data analysis, and then report writing, and then the cycle continues like that. So this whole cycle is what is called research methodology. So going back to the research approach as a framework for conducting a study, it includes a set of assumptions that you have as a researcher, your beliefs, and the values that will guide you as a researcher. Now, the particular approach that you will use for your research depends on the type of data that you want to collect. And there are three approaches to research. We have the quantitative approach, we have the qualitative approach, and then we have the mixed methods approach. For the quantitative, the early forms of research, they originated in natural sciences, things like chemistry, like physics, like mathematics, like biology. These are areas where you can actually observe and measure, variables in some ways. In quantitative methodology, you as a researcher, you are able to check relationship between variables, and you can test hypotheses, and that is why it is referred to as quantitative. On the other side, the qualitative approach, there are some other areas or disciplines like social sciences, sociology, psychology, that have some challenges explaining human behaviors in measurable terms. For example, either fine, or you can describe how you are feeling. You cannot tell me 11% or 3.2. So measurement tells us how often or how many people behave in certain ways, but it does not tell us why. I can ask another question. Why didn't you come to the clinic? You will not tell me 3.4. You will need to describe, explain, express yourself. So qualitative method is the collection, analysis, and interpretation of interest. So the research that attempts to increase our understanding of why things are the way they are, or why people behave the way they do, is qualitative research. And it also addresses how opinions and attitudes are formed. So when you do a qualitative research, you end up with qualitative data. And when you do a quantitative research, you end up with quantitative data. And these are things that can be subject to mathematical calculations. This method is just a combination of the quantitative and qualitative. And it recognizes the fact that not all methods they all have their own limitations. So it engages the strengths of both the qualitative and quantitative. The other names include convergence, integrated, or combination research approach. That's for the mixed method. In summary, for your research, there are three approaches. It is either qualitative, or it is quantitative, or it's a combination of the two. Our own focus this evening is on quantitative research approach. And then in many ways, when you have a study design, it is actually more important than the analysis, because if the design is faulty, it cannot be retrieved. But if you wrongly analyze your data, it can be reanalyzed. So I want you to see a design like foundation, like the foundation of a building. Once the foundation is faulty, the whole building, no matter how expensive or how beautiful it is, will collapse. And when we talk about study designs, the simplest way to categorize studies is with reference to either the presence or absence of intervention. This is very important, and actually, this is like the foundation of what we'll be talking about this evening. The simplest way to categorize studies is with reference to either the intervention or on the part of you, the researcher, observing. You are not intervening in any way. So by virtue of that, there are two main categories. We have observational research and experimental research. And like I said, it's based on the presence or absence of intervention. So if you, as a researcher, you are intervening one way on your research subject, that is called an experiment. However, if you are just observing what is happening in nature, that one is an observational study design. So let's start with observational study design. Here, the researcher study people and exposure in nature. So it is not the researcher that is causing any kind of exposure. Rather, they just observe and record what they see. It does not involve intervention. Please, I want you to have this in mind. It's very cardinal. One of the easiest ways to be able to identify studies is with the presence or absence of intervention. Observational studies does not involve any form of intervention. Rather, as a researcher, you just observe, you record, you count, and you analyze your results. And they are readily obtained, but they can be subject to bias, which is a systematic error. The observational study design has two subgroups. It can be descriptive. Descriptive is when you, it's a method used to describe the occurrence of a disease or phenomenon by time, by place, and by person. The other type is the analytical, that you can use to examine the etiology of a particular condition or any causal association. So observational study has two. It can be analytical or it can be descriptive. And I'm going to show us a chart that categorizes all these our study designs into analytical or descriptive. I have seen many category classifications online in books, in references, in literatures, but I can tell you that this is the simplest classification and easiest to work with for people to be able to understand the kind of design that they are using. So like I said, observational can be descriptive or analytical. If it is descriptive, it can be a case study, it can be a case series, it can be cross-sectional. I'm sure many of us are aware and familiar with cross-sectional study designs. On the analytical part, it can be a cohort study, it can be a case control, repeated cross-sectional, correlational study, comparative study, and ecological study. In some conditions or some situations, an ecological study can also be a descriptive study, and I will discuss that as we continue. So let's talk about the descriptive observational study. A case study or a case report is a case, one case of unusual finding. Now, for our discussion in this class, I will be using our outcome variable to be tooth coloration or tooth discoloration. Tooth discoloration, and then I'll be talking about our independent variable or our predictor variable as the consumption of green tea. So I'll be using that example just for clarity to explain some of this design. So for a case report, let's assume I'm in my clinic, I'm attending to patients, and somebody comes into my clinic with a complaint of tooth discoloration, and then I look at the mouth and I see the upper central, that's the upper central anterior, that is discolored. However, this is the color of a rainbow. That is a strange finding. It's not something that is common. It's an unusual finding. So for a case report, I will report what I have just found by describing that patient. Possibly a 24-year-old man, came to my office. I will talk about his work. I will talk about some other habits. I will record his dentition. I will record the soft tissue heart tissue and everything. And I'll be talking about my finding of a rainbow-colored tooth discoloration. That's a case report as a finding. So when we talk about case series, it is now multiple cases of that same finding. So let's assume I have the first patient and I have kept his clinical records. And then in the course of my practice, maybe 2 weeks or 3 weeks after, I saw another patient or sometime another patient. So I have 3 patients having rainbow discolored teeth. I can now combine these 3 and then write what I have seen. So I have a series of 3 cases of rainbow discolored teeth, which I can now write as a case series. So that is an example where everything was in my clinic. But let's assume that I am working here in Nigeria. I saw a case of a rainbow discolored, a tooth discoloration with a rainbow color, and somebody in South Africa also saw something similar. And then I have somebody else, possibly in Kenya, also saw something else, and we are colleagues, and we pull together all those our findings, and then we submit it together as our finding. That's also a case series. So it doesn't have to be only you, it can be you and your colleagues, but as long as it's a similar unusual finding from 3 different places or more, then you can pull it together to a series. But if it is only one, it is called a case report, and it's just describing what you saw. The epidemiological study is just a cross-sectional study. We'll talk about that as we continue. So like I said, the case series consists of collection of reports on the treatment of individual patients with the same condition or of the reports of a single patient. They are used to illustrate an aspect of a condition, or the treatment of an adverse reaction to a treatment. So most of the cases we see, like all these syndromes, Burkitt's lymphoma, Down syndrome, all of them will have at the beginning appeared as a case that somebody reported and possibly ended up having his name used, as the description of that case. And after some time, it became widespread. You need to know that it doesn't have a control group, and that is why they don't have statistical validity. So this is an example of different cases, 1, 2, 3, 4, all of them pulled together and submitted as a journal article. So this one is a case series or case reports, as in plural, reports as in S. The cross-sectional study is also called a prevalence study. In cross-sectional studies, you cannot determine incidence because incidents are newly occurring conditions. So it is one in which the subjects are sampled without respect to disease status, and they are studied at a particular point in time. It's just like taking a picture of a condition of a situation. Exposure and disease outcome are determined simultaneously for each subject. So if you are asking about tooth discoloration, I can go to a population and I want to assess the prevalence, of tooth discoloration in that condition, in that population. So right there, I will be checking for tooth discoloration on one pipe, and then I will be checking for how many of them are taking green tea. So we have a tooth discoloration, green tea. So I'm asking, that is what I meant by exposure and disease are determined simultaneously. This is an example of a cross-sectional study. This is a population. I go there, I just take a snapshot of what is obtained at that particular time. I'm going to be using a table to explain most of this study design, and this is some symbols I'm going to be using in the table. I just want to explain them to us before I continue. So anywhere you see E, it will be taken like an exposure. If it is an observational study, it will be a predictor variable, and if it's an experiment, an independent variable. It can be a treatment variable, an explanatory variable, a possible variable, all the other synonyms of independent variable. The O is an observation or the outcome variable or the dependent variable or a response variable or a criterion variable or whatever variable. So we have E, and then we have on the other side, we have O. So it's like E is working on O. When you see ON, it's just talking about the sequence of observation. You will see more of that when we come to repeated cross-sectional study or experimental study. When you see a plus sign, what I mean is that there's an intervention or a treatment by the researcher. When you see an M, it means there's matching. R means randomization. QR means quasi-randomization. And the arrows there shows the direction of the study. So for the descriptive type of observational study, these are what I'm trying to say. A case study is just one particular observation that you have, and it's also known as a case report. So you just describe it in total, in full, by talking about all the characteristics, the demographics, the clinical finding, and everything you can talk about concerning the case. For example, the tooth color, the tooth discoloration I spoke about. A case series is a compilation of different case reports. So it might be more than 1 or 2 or 3 or 4. I put this one in a past setting because in a case series, it's possible you have seen a particular case before that you have kept. And then when you saw another case, you went to pick it up to add up to the ones you are seeing present and then to report it. While a cross-sectional study is also known as a prevalence study, is just checking both exposure and outcome simultaneously at the same time. I want you to look at the arrow and the line there, that there's no particular direction of the line. So you are just checking both the exposure and the outcome at the same time simultaneously. Now let's quickly look at the analytical studies. Like I told us, we have the cohort case control down to ecological. We start with cohort study. It's an example of observational. Why? Because the investigator just takes measurements, it doesn't intervene. The aim of cohort study is to find out if there's an association between an exposure and the outcome or dependent variable. They produce the best information about causation, and it has other synonyms like follow-up. So when you see follow-up study, it means cohort study, prospective study, concurrent study, longitudinal study. All these are synonyms of cohort studies. Generally, there are 2 types of cohort study. Number 1 is the retrospective cohort study, where a population is identified at some time in the past and traced forward in time. I'm going to show us a slide to explain what I've just said. The other type is prospective cohort study, where the population is identified at the present and then they are followed up into the future. The third type is a combination of the two, which we call retrospective prospective cohort. Just a combination of the retrospective study, retrospective prospective cohort. That's the third type of cohort study. Look at this chart here. This is the prospective versus retrospective cohort study design for a 10-year follow-up. So for the prospective part, we are in 2024. So as a researcher, I collect or I select my population this year or possibly now, if I'm starting now, and then I follow them up for 10 years, and then I will be ending my study in 2034. That is 10 years time. That is a prospective cohort. That means I started now and I'm going into the future. For the retrospective, this is where I am. This is 2024. As a researcher, I go back into the past and then I identify my participants and then I follow them back to present. That is, I'm still ending my study this 2024, now that I started. So I went back to the past 10 years ago, that's 2014, and then I follow them up to the present, that's 2024. That is called a retrospective cohort. The interesting thing with this cohort is that it can only be done with records. Since you are not a time traveler, there's no way you can go into the past and conduct the study in real time. So that is why if you have good records, you can do a retrospective cohort by going 10 years, 15 years, 5 years back into the past, gathering those records and following the documentation down to the present for you to have, whatever you are looking for. That is the retrospective cohort. This is a picture to tell you the different types of cohorts. I told us the word concurrent is a synonym for cohort. So this is a prospective cohort, concurrent one. I'm starting now and I'm going into the future. That is a concurrent one or a longitudinal follow-up. The non-concurrent one is the retrospective cohort, where I'm starting my study now, but I went back into the past and then I followed up my participant to the present. That's the non-concurrent study. Another name is historical cohort. Another name is retrospective cohort. The mixed design is a condition where I started in the past. So this is the present. I started in the past using the records of my participants till date, and then from date, I now follow them to the future. So the past here is records, but from present to the future, it is the live human beings that I will now follow up to the future. That one is what we call the retrospective prospective cohort, a mixed design for cohort study. So what happens is that there's a population that does not have the disease, and then from those population, I choose those who are exposed and those who are not exposed. So going back with my analogy of tooth discoloration, I look for a population that does not have tooth discoloration. And out of that population, I divide them into two, those who are drinking the green tea and those who are not drinking the green tea. I follow them up for some months or some years to look at those who have discoloration among those who take green tea and those who have discoloration among those who do not take green tea. I have to do matching, to make comparability easy in the process of follow-up. That is a cohort study. So this is just a picture to show us. This is you as the researcher. You have a population that you screen that are healthy. For example, those that do not have tooth discoloration. For those that have tooth discoloration, they are removed. These ones already have tooth discoloration. So out of this population, I select those who are taking green tea as my exposed group, and I select those who are not taking green tea as the unexposed group. I follow them over time into the future to look at how many will come down with tooth discoloration among the exposed, how many will come down with tooth discoloration among the unexposed, and then I do my calculation of relative risk. For the retrospective cohort, I am the investigator. This is the present. I just go back into the past, and like I said, for this particular one, I can only work with records. So if there are records of people's dietary behavior, possibly of taking green tea or not taking green tea, I now follow them up, possibly in a dental clinic, to now see how many of them develop tooth discoloration. Out of those who are taking green tea and out of those who are not taking green tea, how many of them develop tooth discoloration? I follow them down to the present. So like I said, this kind of study can only work with records. It can only work with records because there's no way you can travel back in time to conduct that study and follow them up in real time. Case control study is another type of analytical observational study. So a case control study is one in which the person with a condition, and that condition is what we call cases, you identify them, and you also identify suitable comparison, which we call control. And the two groups are compared with respect to prior exposure, very important. So a case is somebody who has what we are looking out for, like the rainbow-like tooth discoloration, and the control is somebody who does not have that particular outcome. And it's usually advisable to use control from the same population where your cases were selected, and they should be comparable to each other. And your control should have the potential of becoming cases. For example, talking about tooth discoloration, in your control, they should have natural teeth. If they're having dentures or maybe porcelain teeth or all this other type of teeth that cannot have tooth discoloration, it will not be a good control. So your control must be susceptible to the disease of interest. You should do matching for comparability, and that matching is just selecting controls that are similar to your cases in certain characteristics, such as age, race, gender, diet, and so on. It's just for you to reduce confounding. Now, because subjects are identified after the disease has developed, very important. In cohort study, we follow up until the development of disease. In case control study, the disease has developed, so we identify them after the disease has developed, and then we are asking them about prior exposure. And that is why case control studies are sometimes called retrospective or backwards design. Look at the word retrospective. It's just a standalone, unlike in the cohort. Somewhere here, where I was talking about case control study, from a reference population, that's where you select your cases and you select your controls. And from your for the study, you actually go from outcome to exposure, unlike in case control, unlike in cohorts rather, where you go from exposure to outcome. In case control, it is from outcome to the exposure. by the direction of that arrow. I don't have my slide show. I don't know why it's not working. I will have used my own annotation to show what I'm talking about. However, this is an example of a case control study. On the left, we have, okay, so we start from the right where the cases are identified, and we have a matching control. That is the one at the base. So we ask them questions about prior exposure to any particular exposure we are interested in. And for this particular example I was talking about is green tea. So we'll be asking them about if they consume green tea, that's in the past, for those who have the cases of discolored teeth and those who did not consume green tea, and we document our findings. Likewise, for the control, we ask them about prior consumption of green tea, and for those who did not also consume, for us to be able to do our odds ratio calculation. So talking about the past, what is then the difference between retrospective cohorts and case control studies, since both of them deal with past experiences of participants? Retrospective cohorts, being a cohort, always starts from exposure to outcome. Every cohort case is from exposure to outcome. Unlike case control, that we want to determine exposure after you already have an outcome that you are working with. So it's just the inverse, the opposite way. Cohort goes from exposure to outcome, case control from outcome to possible exposure. Also, in retrospective cohort, it identifies the groups based on their exposures, while a case control identifies groups based on either their cases or control, that is either they have the disease of interest. Case control cannot estimate incidence because it's something that has happened, whereas for cohort study, we can estimate incidence because we are doing a follow-up and we can know when the occurrence of particular condition comes up. And the difference between cross-sectional studies and case control is that in cross-sectional study, both the outcome and the exposure are examined simultaneously. But in case control, we start with the outcome and then we go back into the past to ask about possible causes or prior exposure. Secondly, cross-sectional studies do not have control, unlike case control, and cross-sectional studies are basically for determining prevalence, of health outcomes or the determinants of health. In repeated cross-sectional, look at the definition here. It says a cross-sectional study done at different times prospectively. That means something that goes into the future. That means that maybe I have a particular population now. I go in there to examine the prevalence of tooth discoloration, for example. Maybe a particular cohort of undergraduate university students. And then I go back there in about 6 months to still examine them to check for the prevalence of tooth discoloration. I can go back there in 12 months. So it's just the same cross-sectional study, but I'm doing it repeatedly in the same population over a period of time. That is the word prospective. So this is an example of a cross-sectional, a repeated cross-sectional. The first snapshot might have been done like maybe today, and then I go back in 6 months' time to have the second prevalence study, which is the second snapshot. And like I said earlier on, using the table, to try to describe some of this observation, the E is the exposure, the O is the observation, the ON is the sequence of observation, and those red arrows are the direction of the study. So look at this particular table. For the cohort study, like I said, there are other synonyms. It is analytical and it is observational. For the prospective cohort, it starts in the present and it goes to the future. It starts in the present and it goes into the future. There is a mistake in that. There's a mistake in that annotation I have there. The exposure should come in the present. This is supposed to be the exposure. Why this is supposed to be the outcome? I'm sorry for that mistake. But I want you to look at the direction of the arrow. It starts in the present and it goes into the future. For the retrospective, the exposure is identified in the past and it is followed up to the present, for you to check for the outcome. And if you notice for the prospective, there's matching. For the retrospective, there's also matching. And for the retrospective prospective, which is the mixed method, It starts in the past and it goes all the way into the future. So that is for the cohort study. For the case control, it is in the present that you check, and then you go back into the past to ask about prior exposure. I want you to note the direction of the arrows here. Everything about cohort is forward, but for the case control, everything is going backwards. And for the repeated cross-sectional, it's just like a cross-sectional study that you have repeatedly, over a period of time, starting from the present and going to the future. And it is done in the same population, but might not be the same people. You just go there, you take a cross-sectional of the same population. You take your own sample, you take your data, and then you compare with the previous exposure that you have done. So still talking about the analytical studies, we have discussed cohorts, we have discussed case control, we have discussed repeated cross-sectional, we have discussed correlational, we have discussed, we are going to discuss correlational, comparative, and ecological now. So we have discussed the first three. For the correlational study, it's a type of research design where a researcher seeks to understand what kind of relationship or association or correlation naturally occurring variables have one with another. So it's a design where the relationship between variables, you as the researcher, you did not do anything, you are not intervening, you are not controlling, you are not manipulating anything. Otherwise, that would have been an experiment. But all you are doing is just checking the correlation between the two variables that you are picking from your study. It wants to determine if two or more variables are related, and if they are related, how are they related? For example, what is the correlation between the volume of green tea consumed and the degree or intensity of tooth discoloration? So the variables we have here is the volume of green tea and the intensity of tooth discoloration. So it might be something like a cross-sectional study, but this is the research question that you are trying to answer. And by virtue of that, that is a correlational study. I want you to know that a correlational study is not the same as a comparative study. Where correlational study talks about checking the relationship between naturally occurring variables, when we talk of comparative study, you are looking at and comparing two groups in an attempt to draw a conclusion about them. Here, the researchers attempt to identify and analyze similarities and differences between groups. So comparative has to do with groups, correlational has to do with variables. I want us to have that understanding. This is an example. What is the relationship between the occurrence of tooth discoloration among civil servants and farmers in central Kenya? So we have two groups here, civil servants, the other group is farmers, and that is a comparative study. Ecological study, on the other part, here is a bit different in that the unit of analysis is populations or group of people rather than individuals. Populations, groups. In the previous study designs that we have seen, all of them are individuals, but here you are working with population. You want to understand the relationship between the outcome and exposure at a population level. And population or the group, they represent people with a shared characteristics. It might be a particular geography, it might be an ethnic group, it might be a socioeconomic status, it might be anything, but they are on a population level. Look at this example. What is the relationship between the state budgetary allocation for health and the pattern of the tooth discoloration in 4 states in southern Nigeria? If I'm going to do this study now, I need to go and get the figures of that's the budgetary allocation for health. And then for the pattern of teeth discoloration, I might have to go to all the dental institutions, the dental clinics, dental hospitals, and look at their records to see how many dental teeth discoloration cases they've had over a period of time. And then I can look at the relationship between the allocation for health in those states. So it's not as if I'm going to meet human beings individually, rather I'm working with, a population. And this information are usually abstracted from published statistics or from the records, in the institutions where you are going. The feature of ecological study is that the analysis is not based on data on individuals. The analysis is not based on data on individuals, it's data on population. Note that association at population level may not always reflect association at individual levels. That is what is called ecologic fallacy. You might think that what you are seeing on the population level is the same as individual level. There might be other confounders, other factors that might alter that and might affect that kind of association. That is called ecologic fallacy. And going by the same kind of table to try and explain what I'm talking about, look at this particular table 3. For correlational study, it is exposure and observation. Look at the arrow. The arrow is pointing to the 2, so it's non-directional. You are just looking at 2 variables and you are trying to compare their relationship between the exposure and the outcome variable, and they can be any variable. For the comparative study, you can see I have 2 different, what's it called, studies there. Study for group A and study for group B. Like I said, it looks more like a cross-sectional study. However, you are doing the cross-sectional study in 2 different groups to compare the findings. That is why it is called comparative. And if you look at the lines there, it doesn't have any particular arrow. That's why I say it's like cross-sectional study. For the ecological study, it's more like a cross-sectional study, but what will make it analytical or descriptive is actually your research question. If your research question is just looking for a prevalence or a pattern, that will be descriptive. But if you are looking at a relationship or an association or a correlation between 2 or more groups, 2 or more population, that will make it analytical. And like I emphasized in the slides on ecological study, the unit of analysis is actually populations rather than individuals. If you will permit me, please, I think our time is fast spent. I would like to stop here. If we have another opportunity, I can then discuss experimental studies. That's for study designs, quantitative study designs for oral health research, because I would want us to at least have some contributions, some comments, some questions, concerning the ones we have discussed so far. So I will just go back to the summary of what we have discussed so far, and that is observational studies. And I told us that we have descriptive and we have analytical. Under descriptive, we have case study, case series, cross-sectional. Under analytical, we have cohorts, we have case control, repeated cross-sectional study, correlational study, comparative study, and ecological study. I really, really sincerely apologize for that interruption. It took us back a bit, but I'm sure at least for the observational part of our class, we've been able to understand 1 or 2 things. So I will hand over back to our moderator to see if we can entertain some comments and questions and what we can do in the time that we have left. Thank you for your audience.
Thanks a lot, Dr. Taiwo, for this lovely and informative session. If anyone now has any questions, anything they would like to say, please go ahead. Okay, we're waiting for any question. Dr. Mina, Dr. Matinta, Dr. Nermeen, and Dr. Yasmin are thanking you a lot, Doctor, for this session. And it was quite informative.
Thank you.
Okay, someone has their hand raised. Dr. Francis, your mic is allowed. You can go ahead.
Me? Yeah.
Yes,
Yeah, can
we
you
can
hear me?
hear you.
Okay. Thank you so much, sir, for the wonderful presentation. I particularly appreciate when you try to make the differences around the correlational comparative study. So, but I also didn't get it completely. If you can just again briefly highlight the key differences, I would really appreciate that, sir. Thank you.
Okay, the key differences between which particular ones?
Correlational and comparative, sir.
Correlational and comparative. Okay, so
Yes, sir.
when we talk of correlational study, I think it's just the next slide. Yeah. When we talk of correlational study, you are working with one group, but in that group, you are trying to correlate or check the relationship or association between some variables in the group. You might say, for example, you are working with a group of students, and then you want to check the number of hours they spend, studying, and you want to compare it with their performance, their academic score. That is correlational. You are checking only one population, that's a particular university, and then you have some students, you want to check the number of hours they spend studying, and you want to compare it with their academic performance. That's correlational. So when we talk of comparative, now you might want to check the academic performance of University A. You want to compare the academic performance of University A with the academic performance of University B. Now you are talking of two different populations, and you are comparing a particular variable, a particular outcome among the two universities. So it's population that will make you to know the difference. One is one population, but you are checking two or more variables within one population. The other one can be two different groups or more, and you are checking a particular outcome of interest among the two or three different populations to see if there's any association, if there's any kind of relationship amongst them. Does that make some sense?
Yeah, thank you so much, sir. Really very clear now, sir. And if I still have the opportunity, I noticed that some people put cross-sectional study design under the observational, under the descriptive, while some also put it under the analytical. I've tried to give some reasons for this. I don't know the particular reasons that
the reason is that cross-sectional, what they are actually trying to do is the correlational study. Because anything that has to do with you being able to generate an hypothesis is analytical. Ideally, in cross-sectional study, you cannot generate hypothesis because it's purely descriptive. So all you have to do is just maybe prevalence, frequency. You cannot do chi-square. You cannot do t-test. You cannot do any other thing. But the moment you want to be checking the relationship or association, or correlation between variables here and there, you have gone beyond the tenure or the boundaries of cross-sectional. You have actually jumped into correlational. That is why in some literature, you will see them put cross-sectional under analytical studies. You get the point? So it depends, but really, those kind of studies should have been labeled correlational instead of cross-sectional, because it's the research question that will determine the type of study you are actually doing. The research question will determine the type of study you're actually doing and the design that you need.
Yeah, thank you so much, sir.
You're welcome, sir.
All right, we have a question in the chat. Dr. Mutinta is asking, kindly briefly explain the main difference between experimental and observational study designs.
Beautiful, very, very beautiful question. Now, as I said ab initio, that's at the beginning, there is one cardinal difference between observational and experimental study, and I think I underlined it somewhere. Look at the third point here. The simplest way to recognize or to categorize or to differentiate an observational study from an experiment is the presence or absence of intervention. What do I mean? If you, as a researcher, for example, let me use the example of the tooth discoloration. If you gather some people and you are giving them green tea and you want to look at the effect of that green tea in their mouth, if it will lead to tooth discoloration or not, that is an experiment. However, if the people on their own, they naturally take green tea, you are not the one that gave them this time around, They naturally take green tea, but you are just observing to see if it will end up in a tooth discoloration. That is observation. So the difference between experiment and observation is that in experiment, it is the researcher that does the intervention, that gives them the exposure, that gives them the treatment, that does something and wants to look at the effect of what he or she has done. Whereas in observation, whatever it is has happened in nature. You are just observing and recording and then analyzing what you have observed. The cardinal difference is that, see here, there are two main categories based on the presence or absence of intervention from the researcher, from the investigator. So if I go somewhere now and I'm observing people that have been taking green tea on their own and I want to check if there's a tooth discoloration, that's observation because I didn't give them the green tea. But if I go to a population and I gather some people together and start giving them green tea, maybe for 2 weeks, 3 weeks, 1 month, and then I want to look at the effect, that is an experiment. Why? I was the one that gave the exposure. And that is the easiest way to differentiate observation from experiment. Hope it makes sense.
That was very insightful, Doctor. Thanks a lot. Anyone else, guys, want to ask about anything? If there's any more questions, please let me know. All right, then, seems we don't have any more inquiries or questions around. So I guess this concludes our session for today, or the webinar. I will leave the link for the feedback in the chat right now, and I will also send it on the WhatsApp group. Please take a moment to fill in this form. And yeah, that's pretty much it. Thanks a lot, Dr. Taiwo, for this great lecture. I personally learned a lot from it. This is very nice. Thanks a lot, people, for joining us for today, and we'll see you in our next webinar.
Thank you so much for having me.
We're honored to have you, Doctor. Have a great evening, everyone.
Yeah, bye-bye.
All right. Have a great evening, guys. Bye-bye.